May is National Stroke Awareness Month. Knowing the signs and getting someone medical attention quickly can save their life. WECT's Maura McJilton reports one man saw the signs, but he said he didn't know they pointed to a possible stroke.
David Christie says he and his wife live an active lifestyle, but things changed quickly with some health concerns. Now he's glad that he didn't ignore those changes in his health because he knows the outcome could have been a lot worse. 74-year-old David Christie had a stroke about a month ago, and just by looking at him and talking to him, you wouldn't really know. He credits that to the quick actions of a sheriff's deputy and nurse that were nearby when things started to go downhill.
I had a lot of pain. I couldn't stand. And a lot of pain in my left side, and my left side just kind of collapsed. And the next thing I remember is that we have a friend here in the community. He's a deputy sheriff. I just remember him holding me and saying, "I've got you, David, I've got you." And after that, then he said, "Get him in a chair." You know, he took action right away. And there were a number of other people there. I remember somebody gave me an aspirin, a nurse.
Christie says that day is still a blur for him, but he knows all the signs of a stroke were there. But at the time, he didn't know those were the signs.
Had some issues with high blood pressure, just came out of nowhere.
Dr. James McKinney at Novant Health's Neuroscience Institute says high blood pressure is the #1 risk factor of a stroke.
After that, diabetes and cigarette smoking and high cholesterol, sleep apnea, those are all things that we can address.
Those are the underlying reasons, but what are some physical signs to notice when someone is having a stroke? There's an important acronym to remember.
BFAST, so B stands for balance, so sudden onset of dizziness or imbalance. E is eyes, so vision loss in one or both eyes. F is face, so a facial droop. A is arm, so really arm or leg weakness on one side of the body. S is speech, so slurred speech or difficulty producing words or understanding speech. And then T is time to call 911.
McKinney has 20 years of experience and says recent advances in medicine and technology have helped treat patients in a safer and more efficient manner. All things that helped Christie make a full recovery within a week of his stroke. Now he's sending this message to others.
If you have like a precursor, if you have something that starts to like, I can't quite raise my arm or something, don't ignore it. If you don't do anything, you may well not wake up from it. So pay attention to the signs, learn the signs, and act on them. Yeah.
Now Christie says he's still doing his daily activities like playing pickleball and painting, but he's taking it a little bit slower these days. Maura McJilton, WECT News.